How many meals should one eat in a day? It seems normal to have 3 meals a day. Have you thought about since when people began to eat 3 meals a day? A popular opinion is that it started from China about 1,000 years ago. That was when the dynasty was very wealthy and was doing a lot of businesses and trading with the Middle East and the West. Before that, the Chinese people were mostly having 2 meals a day. And after that, more and more people began to have 3 meals a day. This opinion makes a lot of sense because if we look into the Bible, New Testament, about 2,000 years ago, most people apparently were not able to afford 3 meals a day. The world population began to expand only after the new world food, such as potato and corns, began to spread worldwide, so that the limitation of food and calorie supply has limited the population. Nowadays, 3 meals a day seems to be a standard in most of the world. When we look at the content of the 3 meals, it's quite different in the East and in the West. In the East, the lunch is special, is quite important, relatively equivalent to dinner in terms of its importance. But in the West, lunch is very simple, mostly just some sandwich or some fast food. Doctors of different specialties have different suggestions regarding how many meals should one eat in a day. For example, a general surgeon may suggest many meals a day but only very little food in the meal. This suggestion is for those patients that a large normal meal may have too much burden on the digestion tract. However, this is not good from the point of view of an endocrinologist, since the frequent eating is gonna keep the insulin level high. A few psychiatrists have the problems of overweight, obesity, and even diabetes. I realize that they do have this kind of stress and they need food to cope with it. They seem to have more frequent eating. Apparently, diabetes is a highly preventable condition and a totally lifestyle issue. Unfortunately, it's kind of like absurd that doctors get diabetic. Nowadays, doctors focus on their little subspecialty or specialty. They seem to don't care about other field, especially the specialist. Psychiatrists hardly know about the physical science. A cardiologist doesn't have to look into the gastrointestinal science. And a gastrointestinal physician doesn't have to be an expert in endocrinology. A family doctor may be more comprehensive, but they hardly give any detailed plans or suggestions. Recently, lifestyle medicine seems to be in the curriculum of medical schools, which is great because if they took the course, we cannot assume that they don't know those stuff. Obviously, if you ask people to have 2 meals a day, most people is gonna feel hungry. So that 2 meals a day for every other day seems to be a good idea for intermittent fasting. Since the important health issue in many countries is the oversupply of food and calories. Another realistic question is that for most of the workers on the labor market, it is important for them to get enough calories to be on their work position. Unless you are a freelance or you are the boss, so that you have the freedom of when to eat and how many meals to eat and what to eat. That's it for today. We discussed how many meals should one eat in a day. Thanks for watching and listening. See you next time.